We're at the Los Lunas Transportation Center. We're here to let the citizens of Valencia County have a couple of nights where they can find out about the plan that Lovelace Health Systems has for Valencia County and how they can use their brand and their doctors to benefit Valencia County and its residents.
Nurse. So a couple of things. What we want to be able to do is to do in Belen a wellness center. We are aware right now Belen has an urgent care. What we're looking for the community at large is two things. One, a hospital for when you are sick. And for our hospital, we're looking at a freestanding emergency room. We also want to treat the community when the community is well. And so people should not have to drive all the way to Albuquerque for preventative care, for services that are only in Albuquerque. So we're looking at a wellness concept in Belen, building a 24/7 emergency room in Los Lunas. We're also looking with nursing schools to see if we can get a nursing school interested in doing a nursing program in this county. We think that would be helpful, one, to make sure we have enough clinicians to take care of patients, and two, because if people right now are interested in going to nursing school, they again have to leave this community, drive up to Albuquerque. So we would be the sort of management group for both the wellness center and emergency room. And you see that the last one that says we want to connect it to provide an efficient network for accountable care. And we want to partner with others in the community that may already have services. We're not looking at doing services like an urgent care because one exists. We're not looking at doing services like a home care because home care services exist. We want to partner with those entities to be able to transition patients into those entities, again, with the goal of everybody staying here. So this is really kind of how we did the demographics and a little bit about the area to help us decide what we needed to do. Next slide, please. So this is kind of what we proposed for the Wellness Center in Belen. You'll see there's a lot of programs for health. We want people well. So we're talking about blood pressure checks, we're talking about glucose checks, because two predominant issues that exist in this county are hypertension and diabetes. We want to be able to look at people who may have some body fat analysis to keep them healthy, cholesterol checks, pulse oximetry, which is a way of measuring how much oxygen you have in your blood, heel scans, which are the scans that you can do on folks, especially females, because it's an indicator of bone density, so it's an indicator of your risk for fall or fracture. And then senior wellness checkups, also giving vaccines and flu shots. So that's the first concept around health screenings. Then we want to do workshops for learning. We want to do things around diabetes education and counseling. We want to do things around healthy eating, healthy living. We want to do things around exercise, teach CPR, and you'll see a bullet there around health insurance and Medicare 101. Lovelace no longer has a health plan. We sold our health plan off. We then can be very unbiased about different health plans and what their offerings are and be able to educate folks. And of course, Medicare just continues to get more complex, not less complex. We want to do medication review, where people will bring their medications in, meet with a pharmacist, have that pharmacist review their medications. Oftentimes when we do this, we're finding people are on medications that actually contradict one another. One physician gave them one medication, another physician gave them another medication. The two physicians didn't know they had both, and they really shouldn't have both. So we'd have pharmacists available to do that. We want to be able to help folks with living wills, advance directives, again, counseling. We also want to do something around fall prevention. Third most common reason people come to an emergency room is a fall. Typically, they don't injure themselves, but they're scared. They don't know. They may have a bruise. It's sore, it hurts. They get x-rays done, etc. Want to prevent those falls. Then activities for fitness, and we also, of course, want to have activities for fun. Next slide, please. So then we have the second part of the proposal, which is a freestanding emergency room. It would be licensed as a hospital. It would be a 24/7 emergency room. It would have an interface with the Berlin Wellness Center. For example, if somebody came into the emergency room after a fall and their x-ray was negative, we would want to refer that person to the Berlin Center into that fall prevention program. Because good news is they fell once, they didn't break anything, we don't want them to fall over and over and over again. We would want to have office space for visiting specialists. So the physicians that may not reside in this community, we think we can entice them to come down and be able to hold office hours so people would not have to drive to Albuquerque to see those specialists. We want to, again, have it be adjacent to proposed nursing school. We want it to be expandable, so we want a large plot to be able to expand it either up or out as we need. We're going to have a robust lab. We're going to have radiology services. The radiology services are also going to include ultrasounds, which you need often for people who come in the emergency room with abdominal pain. And we want to have a CT scan. Again, people that fall and they're not sure if they've hit their head or they may have hit their head, we want to be able to do a CAT scan on them, not have to ship them to Albuquerque for that CAT scan. And we will staff it by emergency room physicians and emergency room nurses. Next, please. So a little bit about Lovelace. Again, we've been in the community 100 years. We do hospitals. We have 4 hospitals in Albuquerque. I am the COO at one of our hospitals, which is Women's Hospital. We also have a rural hospital in Roswell. So we do hospitals. The best thing about sort of having an affiliation with Lovelace is if there is a service that the community currently doesn't have and we have it in Albuquerque, it makes it really easy to sort of have those resources deployed to the community, because sometimes it may just be a one-time need. Other times it may be something that we need to continue, but it gives a way for the community to see the different services that they may need rather than having to have them all at once. So again, the whole goal is to have kind of that primary care delivered in this county, with folks not needing to travel to Albuquerque. Next, please. So again, everybody hears the term accountable care organization, and really what we see that means is the services you need, the majority of those services be able to be delivered in this community where and when you need them. Next slide. So again, the summary I wanted to talk about is the Berlin Wellness Center, Las Lunas, the freestanding emergency department, and the potential for a nursing school. We would do it under sort of the accountable care model, which is keeping people well out of the hospitals, and we would operate it as Lovelace Health System. And now I want to open it up for questions. I know you have them. Yes, ma'am.
You said since Lovelace is not in the insurance business anymore.
Correct.
Most other insurances.
Lovelace is not in the insurance business anymore. The model that we have, we plan to take all insurances. It allows us to do that.
Including Medicare, Medicaid.
Medicare, Medicaid, Presbyterian, United, name it, we wish to be able to serve that community need. So yes, we plan to apply for all insurance companies. Originally, when we came down to the community a few years ago, one of the things that I did was go and meet with a lot of doctors and ask them what were they frustrated by. And they were frustrated by having to send their folks to Albuquerque for a CAT scan, or not having that specialist in this area and having to refer folks up to that specialist in Albuquerque. That was just frustrating for them. So we would have to do a needs assessment to see what the needs are of the community. Because oftentimes the biggest headaches for physicians are setting up that office. That's not what they want to do. It's not what they love. So our goal would be, we'll do it for you and have certain doctors commit to being in the community twice a month, once a week, whatever their patient demand may be. Yes, sir.
On your proposed nursing school, would that be connected with the university, or does Lovelace have their own system of training nurses?
We currently don't have our own. We partner, however, with the University of New Mexico in 3 additional nursing schools.
And so we would look to partnering with one of those groups. Again, we think it would make for a nice rotation for the nursing personnel because some of the rotations they get the least exposure to are the emergency rooms. Because everybody wants to get into the emergency room. But in a hospital, you only have one of those and you have a bunch of floors of other stuff. So typically the nursing schools don't get a lot of emergency room rotations. So we think it will entice them and we want to be able to approach all of them and say, this is the model, we would love for you to be involved with it. Yes, sir?
Okay, I'm told you're planning to take the entire hospital mill levy fund to operate this thing. And what are the other costs that the taxpayers have to look forward to?
The answer is the mill levy would go to Lovelace Systems. But after that, Lovelace, well, we're on the hook as developers for any real estate activity. None, as you know, perhaps some of you folks don't know, in the state of New Mexico, you cannot use mill levy funds for any kind of real estate activity. It has to be operations of hospitals or the facilities. So we're not getting a penny. Lovelace would get the money. And on top of that, then at that point, Lovelace is responsible for all operating costs.
Right.
And there is a commitment starting out. I do think that you folks will probably end up buying the facility, but there's a commitment that they'll sign a 10-year lease that we have an agreement on if we can put this deal together. So, and it goes back to, and we're not here to talk about the competition and that. We're here to emphasize Lovelace and their brand.
Let me tell you, I moved here with relatives that had been here for 30 years. They saw the last hospital that was here. Now, my cousin told me, I won't bother to go to the new hospital because this is what you do. You go down there, they send you to Albuquerque. Now, you're going to have a sales program if you get people that's been here for 30 years that's going to use any of this because they're already afraid of you.
That's one of the reasons we put the CT scanner. The number one reason for having to transfer out of an emergency department in one area to Albuquerque or another area is the lack of having a CAT scanner. Because the doctors, if again, somebody who falls, somebody who may be dizzy, somebody whose blood pressure may be up, you've got to think of things like a stroke. You've got to think of things like they may be bleeding into their head. The doctors does an examination. The examination is not conclusive. The patient may be a little bit confused because the stuff is happening to them. What does the doctor need? A CAT scanner. Something to see what's happening with that patient's head and their brain. That's why we're putting one in this ED. It is $2 million. That CAT scanner itself, $2 million. But that's the reason why, is because once they have that CAT scan, like most of the patients are fine. They don't have a bleed. They have just hit their head. It's negative, but that gives them that sense of I'm okay, I can go home. And that's true, they are okay and they can go home. However, if it's positive, we will put them in an ambulance and I will send them to Albuquerque to the best neurosurgeon that I can find.
I remember when the big issue was having a restaurant to go to, and that was, the big thing. We went to our politicians, we'd like more restaurants. We've seen the development of communities or subdivisions and so forth, so I think this is the next step that they need to be aware of is, our health and the care of it. And so it is going to take a visit with our politicians and our voices being heard and so forth, and that really is what's going to get the movement.
Well, they certainly can reach out at the county commission meetings. There's a public forum that they'll be able to stand up and speak and address the issues and concerns that they have. They can go and call the county, and then on top of that, they could also go to the county website and express their opinion and what they would like to see accomplished.